Good afternoon, and thanks for joining me here today. We're here today to talk about schools. Superintendents across the county have been meeting with school board members, community leaders, and our own Department of Public Health in the county to find the best path forward for schools this fall. Several school districts are moving to an online-only option for the start of school, and we've seen here in St. Louis County the COVID-19 cases continue to rise. Overnight, the county reported 9.7% of their cases as positive. I've strongly encouraged parents, and I continue to do so, to choose a virtual option whenever it's available. With the alarming increase of COVID-19 in our community, superintendents have asked the Department of Public Health to give a formal recommendation of the best path forward for schools this fall. And a few minutes ago, superintendents received a letter from the County Department of Health, and I'd like to share that letter with you all today. And I'll read from parts of it. St. Louis County is currently experiencing a sustained increase in COVID-19 cases that is the result of community transmission. This trend has been rising for several weeks, and epidemiologists point to signs that the level of transmission is continuing to increase and will remain high for several weeks. While we put measures in place in our community to help control the virus and prevent more serious negative health outcomes, it is likely that it will take some time before those measures can have an impact on its spread. Given the fact that most St. Louis County schools are preparing to open in a few weeks, it's unlikely that the spread of the virus will be sufficiently controlled in order for nearly 300,000 children and 25,000 teachers and thousands of other staff to be able to attend school full-time without a significant risk of an outbreak. Therefore, it is the recommendation of the Department of Public Health that all schools start the semester in as virtual of an environment as is possible to protect the students, staff, and families. And while this recommendation is not a mandate, the Department of Public Health may take further action in the future if school buildings or schools have significant outbreaks that further risk their residents. The Department of Health has the utmost respect for every superintendent and school leader and the decisions they make to protect both education and health. We will provide our constant and full support to every district and school, regardless of whether they are virtual or not. We support school leaders who have chosen to open their schools more widely and know that they are working with available recommendations to increase safety. Despite the thoughtful and protective planning that many have worked on these past months, the current level of community transmission poses the largest risk to the safety of our schools. Many of the new behaviors around mask wearing, social distancing, and avoiding crowds are not yet universal. Even businesses and organizations that have done thorough cleaning and have been vigilant in their social distancing practices have had outbreaks due to the nature of this virus. The department will continue to partner with all school leaders to monitor changes in the data and community adherence to social distancing. We will remain focused on our desire to see students in schools receiving education, and we will share all available data to make sure those decisions are put together in the future. So, adding to what the letter said, I want everyone to understand and recognize this pandemic is a tragedy. It has upended nearly everything in our lives as we know it. Kids are preparing to go back to school for their senior year, like my son is. Parents are preparing to send their kids to kindergarten. Teachers are preparing for what they do to get our kids prepared for the future with the best education possible. But as what has become usual and customary and expected in our lives is just on hold for now. All of these decisions that educators in the health department have made have always been in the best possible light for our kids to protect their health and welfare. And that will always be our top priority. Until masks are universal in our region and everyone adheres to social distancing, this virus will continue to spread. It doesn't know jurisdictional boundaries, it doesn't know county boundaries, it doesn't know city boundaries. And we must come together to push back together as one before we can even begin to have a conversation about a return to normal. And I hear from parents. I'm a parent and I understand the emotions. I understand the anger and the fear and the frustration. and that's normal. It's all justified. But these numbers would not be escalating if everyone were adhering to our public health guidelines. So please, wear a mask and follow our social distancing policies. That's the best chance to get our kids in the best education environment this fall. And now I want to introduce Paul Ziegler, who is the Executive Director of Education Plus, who will come forward and make a few remarks. Paul?
Can you spell your name and the company? Is it one word, education?
Yeah, so my name is Paul Ziegler, Paulziegler, and we are Education Plus, all one word. We are a cooperative of 54 area school districts and 6 charter schools that stretch from Franklin, Jefferson, St. Charles, St. Louis, and St. Louis City. We essentially create a network for them to work on professional development and best practices. For the last 16 weeks, we have met as a group of educational leaders to try and determine what best practices we have to bring students and teachers back in a safe manner. Through that work, we had identified many processes around cleaning and distancing and educational components that we thought would allow us to bring kids back this fall. We are left disappointed. Not disappointed that we have people that think we need to go virtual or not virtual, but we're disappointed that we're not going to be able to bring kids back safely right now. Kids are disappointed. They want to be with their friends. They want to be at the playground. They want to be back in school. Parents are disappointed. They want their kids back in school. They know it's a good place for them. They want some normalcy back in their lives. Our teachers are disappointed. They know school is the best place for their kids, and they know engaging students virtually is difficult. Our educational leaders are disappointed. They're fatigued. They have worked tirelessly to try and come up with plans to do it in a safe manner. But realistically, based on the current surge that we have in our communities, we can't bring kids back in any kind of normal capacity based on what we're seeing. And that's frustrating. It's frustrating for all of us. But we as a community hold in our hands the opportunity to bring kids back, or in some cases keep kids in school by the way we behave on a daily basis. And it's frustrating for educational leaders to not see our community stepping up. I believe it's pretty commonplace that people believe schools are important for our community and for our society. But yet as a community, we haven't taken the steps needed to make sure that we're not contributing to the spread of the virus. And certainly as schools, when we are in a place where we can bring kids back safely, we're going to do that. And we have plans in place to do that. But in the meantime, we have to depend on our community to step up and engage in the type of behaviors and practices that are going to slow the spread and allow us to do as educators what we need to do, and that's educate kids in our school environments.
Thanks. Questions?
What can you do? You can't say to a school district you need to do one or the other. But if there's an outbreak in a school district, can you close down the district? What can you and the health department do if there's serious?
Well, if there's an outbreak, you focus on who's been exposed, and then all of the public health measures would be directed to the exposure and to the risk. So if it's a building, if it's a population, but that can be relatively narrowly focused. But the public health department, by its authority, is limited to imposing its guidelines on an imminent threat. And since the opening of schools is 3 or 4 weeks away, what we can do is say where we see the trends going, and we can give advice. And that's what this conversation has been with our superintendents and our school leaders. But 3 or 4 weeks from now, if we're in the middle of something and it looks like there's an imminent threat to a building, there's an imminent threat to a school population, then the public health response will be focused on those exposed and those threatened.
So would it be, could the public health department say this district's closed because of what's happening there? Or would it be more school by school? How would that look?
Well, it would depend on the amount of COVID in the community and the amount of COVID in that district, and it would depend on the exposure in that school. And it would always be done in a conversation with the superintendents and the school boards. We have a very good working relationship. We have very good conversation. We work together as a team, and I would not expect any of these decisions to be made in any sort of confrontation.
But meaning the county and the health department could close down a school.
Oh, absolutely. Yeah, if there's an outbreak, any institution in the community, if there's an outbreak, if there's a public health threat, certainly the public health department can close them down in a supportive way to come in and help everyone who needs help, to give them advice, to make sure people get the medical care that they need.
We've heard from some districts announcing a blended plan, 2 days a week in class, 3 days a week in class. Are you recommending to them now to remove that as an option, to take it off the table?
The recommendation of the Department of Public Health is that all schools open in an as virtual manner as possible. But the school districts that are working hard to develop a hybrid model, we will support them in whatever information they need or whatever data they need to move forward with that hybrid model. We can't at this point say you're not allowed to do that, but we can tell them where we see the trends are going, and we can make the recommendation that we believe an all virtual start would be our strong recommendation from the county based on the trends as we see them moving forward at this point in time. 3 or 4 weeks from now, when we get to that point in time, then and I expect us to continuously look at these trends almost on a daily basis or a weekly basis. I expect that all of the schools who are planning to open in a hybrid model will always have a plan ready to go for an all virtual opening. And as we get closer to that start date, they'll be continuously evaluating their position and their decision. But we also have to understand and recognize that a lot of families in our community depend on the schools for support services for the kids. That's where they see a nurse. Sometimes they see a doctor. There are community health services. There are social services there. That's where a lot of kids get their breakfast and lunch. So we have to make sure that those other needs, in addition to education, are also being followed, and that we're doing everything we can to help those families and those kids too.
Has any district objected to this recommendation that you've given them?
You know, there's some pretty lively conversations, but I think all of these are professional and civil, and everybody recognizes we're on the same team. And so we were asked, the Department of Public Health was asked for their recommendation, and it is our strong recommendation that every school open as virtual as possible in the fall. And the ones that aren't ready to make that decision yet, we ask that they have an all virtual plan ready to go. And in the meantime, we'll work with them with whatever hybrid model they're working on.
The White House, as you know, said we're in a red zone. What's that mean to you as a leader of the county?
Well, that means we need to look closely at our social distancing measures and decide whether or not we need more restrictions. And we're looking at those numbers every day. We have new restrictions going into place tomorrow in St. Louis County. We've had mandatory masking here for a little over 3 weeks, and we think that helps as well. We expect that to, if we can get masking more universal and get more compliance with our mandatory masking, then we hope that the public health orders that are going into place tomorrow will bend the curve and will slow this down and get us to a better place in 2 or 3 weeks.
I was at your news conference several ago. You mentioned how you're going to support schools. Is that what all these boxes are?
These are all masks that we're distributing in the community to whoever needs them. We've distributed over 2 million masks in the community already.
You mentioned something special for schools in one of the news conferences.
Oh, we work schools every day with guidelines, protocols. We have a school nurse that's liaisoned with the school nurses. There are so many information pathways and exchange of protocols and recommendations and reviewing their guidelines. It's a continuous process. Any other questions?
As a physician, how worried are you the way we're headed?
Well, it's alarming. I mean, as a country, it's alarming because the sacrifices that we need to make to turn this around are difficult, and they're not universally accepted. Unfortunately, some of these recommendations have been politicized. We're seeing that dialed back a little bit, and I think that's good. But we are currently headed in the wrong direction. In St. Louis County, we're in a little bit better of a spot because of the sacrifices we made early and our more slow and cautious reopening. But we still, we still have to do more. We have to get universal masking. We have to get acceptance of these social distancing measures. We have to limit our exposure in crowds. And if we can't do that, then the virus will continue to spread as it is, and it's going to make it very difficult for our kids to have an in-classroom experience this fall.
Thank you. You did?
Doug, you have anything?
There was a question, we're just trying to get clarification. Will this apply to private schools and universities?
Well, private schools, were not they're always continuously a part of this dialogue. They've been at the table for a long time. And as it stands now, private and parochial schools are planning for in-school options, but I am confident based on our conversations that they will have alternative plans ready and will continue to reevaluate the decisions they made on a daily or weekly basis. We're going to support any school that is choosing a different pathway with recommendations and guidelines and information about how to be as safe as possible for the kids and the teachers and everyone's families. But it is our current strong recommendation from the County Department of Public Health that schools be as virtual as possible this fall.
And you could close them down too. It's not about churches.
Well, if they had, yeah, sure. If they had an outbreak, if there's a public health emergency, then the health department has an enormous amount of authority. We have a great working relationship with all institutions in the community and good conversations, very professional and civil relationship. Anything else? Okay, thank you.
Thank you.